Hi, welcome back to my channel, Zen and Fit. And for any of you who are new to my platform, I discuss mental health, lifestyle topics, and also health and wellness. And in today's video, I'm actually going to be continuing with the series that I've been doing on well-known individuals who've been open about their mental health journey. And in today's video, I'm going to be covering Mariah Carey. As many of you are probably aware, Mariah Carey is a household name. She's known internationally and, of course, within the United States. She's had multiple platinum albums. One of her first top songs that came out was in 1990, Vision of Love. And she's had multiple successes throughout her career, including her song We Belong Together. But along with all the successes that Mariah Carey has encountered, it doesn't mean that she hasn't experienced any difficulties in her life, especially when it comes to mental health. Back in 2018, Mariah Carey actually did an interview with People magazine, and she was open about her mental health. She talked about how she had been diagnosed with bipolar 2 disorder back in, I believe it was 2001. And how initially during that time she didn't want to acknowledge having bipolar disorder. It's like she just wanted to keep it to herself. And a lot of times for people, when it comes to mental health disorders and mental illness just in general, there's a lot of shame surrounding the mental health issue. And a lot of that has to do with the stigma around mental health. Even though things have, of course, gotten better throughout the years, it's still, the stigma still persists when it comes to mental health. It's not seen the same way when a person says, I have, let's say, diabetes versus I'm dealing with depression or I'm dealing with schizophrenia. You know, people react differently. And so, unfortunately, due to that stigma, a lot of times individuals who are dealing with mental illness, they don't want to be open and honest about it, and they don't even want to acknowledge it to themselves. And that creates a problem when it comes to engaging in mental health treatment services, whether it's medication or a combination of medication and therapy services. A lot of times people will not seek out care due to that stigma and not feeling comfortable. For some of you who are listening to this video, maybe you can relate to this. Maybe you've had a friend or a loved one who has dealt with some form of mental illness. And due to the stigma surrounding mental illness, mental health, they refuse mental health treatment. They self-medicate it instead. And of course, this more than likely worsened their symptoms. But due to the stigma and the negative stereotypes surrounding mental health, they didn't want to be open and fully participating in treatment to address their mental health concerns. So it happens all the time. It's very common, unfortunately. And until we as a society get to a place where we can be more accepting of mental health and normalizing it, that, you know, individuals can suffer from mental health crises or deal with different mental health illnesses, just like a person may suffer from a medical condition, whether it's cancer or some chronic health condition. Once we have normalized it as a society, only then will mental health be fully acknowledged and people can actively engage in treatment services to address their mental health concerns. And when I refer to it as a societal issue, what I'm referring to is a lot of times, especially in the United States, there's not as much parity when it comes to investing in mental health treatment in comparison to medical care. A lot of times the reimbursement and everything else that goes along with that is higher for medical treatments, such as for, let's say, for diabetes or hypertension or whatever the health ailment is. In comparison, when it comes to mental health treatment and reimbursement, you'll see that there is a major disparity in reimbursement. And so as a society, we're not investing equally in mental health treatment. And so it really does trickle down on an individual level for people who are dealing with mental health issues. If our society ever did start investing equitably into mental health services and just overall treatment, this could really help to eliminate some of the negativity surrounding mental illness and just the overall stigma when it comes to mental health and acknowledging that you have a mental health disorder. So until that day actually happens, I think that there will always be some form of stigma when it comes to mental health, and it directly affects individuals who are living with mental health illnesses in seeking out any type of care or treatment, because it's like it's something bad, it's something frowned upon, and it's just better for me to not acknowledge it and try to self-soothe the best way I can without seeking out any type of care, because seeking out care means I have to acknowledge what I have and I have to face it. And when society is already shunning it, how am I to want to acknowledge this? Why would I want to acknowledge this? So in getting back to Mariah Carey's journey, it was a process for her to actually accept that she had bipolar 2 disorder. It took her a significant period of time to want to address this, because she just wanted to shun it. She didn't want to acknowledge it. And until she got to a point in her life where she accepted her diagnosis, that's when she actually made a change in her life, and she started participating in medication services as well as therapy. She talked about this during her interview that she did with People magazine in 2018. And that was a significant change in her life. It created some form of balance. And she also went on further to talk about her response to medications and, finding what works for her overall. But she made that happen. And it's unfortunate that other people in society may never get that chance, especially if they don't have access to resources like Mariah Carey has because of her financial status. It was easier for her to navigate into the mental health system. Whereas for other people, when you have, let's say, lack of insurance or just lack of financial resources, it makes it harder. And again, because of the lack of parity when it comes to investing in mental health treatment, it's not the same when you're accessing mental health care versus when you're seeking out something medically for yourself. There's a difference there. It's easier to access medical services versus mental health treatment, because sometimes people, their insurance may not cover it. You may have difficulty securing providers. So it's a difficult process. But in Mariah Carey's situation, it is wonderful that she was willing to share with the public regarding her diagnosis and how she has ultimately dealt with it. I think that can be inspiring for other people out there who may be dealing with bipolar disorder or some other form of mental illness. When you see a public figure like that who is willing to acknowledge their illnesses and are actively addressing it. Hopefully this video was helpful for any of you who are listening or watching this video right now. It hopefully gives you some insight to what a person may be experiencing when they're dealing with a mental illness and why they may be apprehensive to seeking out treatment if there's so much negative stereotypes and stigma surrounding mental health. So I look forward to reading any comments or feedback you may have. And just as a reminder, this video is not intended to diagnose anyone or anything like that. This is just more so of a discussion video. And if you haven't already done so, please hit the like and subscribe button, because it helps me to continue making videos on this channel. So until next time, take care.